Today I want to talk to you about a very important topic, the difference between depression and low mood. Depression and low mood are not the same thing. Depression is a disorder that causes a persistent feeling of sadness and loss of interest in activities for long periods of time. While low mood is a symptom of depression, it can also occur as a normal reaction to stressful life events or in other mental health conditions. Low mood is something we all experience from time to time. We all have moments when we feel low or unhappy. Sometimes there is a clear reason for this, like a loss or disappointment, and sometimes we don't know why we feel that way. This feeling usually goes away after a few days, or when the problem that triggered it is resolved. However, depression is different from regular mood changes and feelings about everyday life. It can result from or lead to problems at school and at work. Depression can happen to anyone. People who have lived through abuse, severe losses or other stressful events are more likely to develop depression. Women are more likely to have depression than men. Depression is not a sign of weakness or a character flaw. It is a real medical condition that can be treated with medication, psychotherapy, or both. However, many people with depression do not receive adequate treatment due to lack of awareness, stigma, or barriers to access. Depression is very common and very serious. The National Institute of Mental Health estimates that 19.4 million adults, or 7.8% of all adults in the United States, had at least one episode of major depression in 2019. So how can you tell if you have depression or just feeling low? One way to do that is to use the DSM-5 criteria for major depressive disorder. The DSM-5 is a manual that mental health professionals use to diagnose mental disorders. It lists 9 symptoms of depression that you can check against your own experience. To be diagnosed with depression, you need to have at least 5 of these 9 symptoms for at least 2 weeks, and at least one of them must be either symptom number 1 feeling low, or symptom number 2 loss of interest or pleasure. The symptoms must also cause significant distress or impairment in your daily functioning. You can use the DSM-5 criteria to check for signs of depression, but remember that this is not a definitive diagnosis. The best way to know for sure is to talk to a mental health professional who can help you get the treatment you need. Depression is treatable, and recovery is possible. You are not alone, and there is hope.